Thank you very much for joining us on our program, and again a warm welcome. Let's start off in Gabon, where a strike action by health workers has partially paralyzed hospitals across the country. The strike has gone on for about a week now. Striking health practitioners in the country on Monday shut hospital gates and limited the reception of new patients. So what are the main reasons for this strike? Well, it dates back to 2015, where bonuses were promised to staff and have not been met. Those promises have not been met. Staff are now demanding those bonuses dating back to 2015. They're also demanding training and better working conditions. Bridget.
And according to the unions, this decision to paralyze the hospital system follows the silence of the government, which has not consented to meet with them since the beginning of the strike. No authority, let alone our supervisory minister, has contacted us, one of their representatives said. On the government side, the Secretary General of the Ministry of Health, Guy Patrick Obiang, deplores the continuation of the movement. He said all the more so as the highest authorities have taken all the necessary steps to ensure that the concerns expressed by the unions can be addressed in the coming days. The movement is for the moment limited to health workers, but doctors are also threatening to go on strike. To now expound on this, we are joined by Jero Wilfried Obangome, Africanews correspondent in Libreville, Gabon. Hello, Jero, and thanks for being with us this morning.
Bonjour, Bridget. Bonjour, Jerry.
It is now a week since Gabonese health workers went on strike. What is the situation so far in hospitals across Libreville?
Avant peut-être de faire le point de la situation, je vous rappelle d'abord que la coalition...
Before taking stock of the situation, I would first of all like to remind you that the coalition of the 5 unions, which are most representative of the health sector in Gabon, is demanding, among other things, payment of the Performance Incentive Bonus, PIB, for the second quarter of 2015. The BIP is a bonus that the state had allocated to civil servants and other agents in order to encourage them to perform well at their workstations. Initially, this bonus was called Fonds Commun and was paid only to employees of financial institutions such as the Customs, Treasury and Finance. But out of concern for solidarity and social justice, President Ali Bongo decided to extend the benefits to other ministerial departments. So the coalition is also calling for the opening of health schools and staff training centers and the regularization of the administrative and financial situation of agents who have been on pre-salary for years. Now, to come to your question, the situation in the hospitals of Libreville is such that the agents in white coats have put the keys under the mat. Indeed, on Monday, March 2nd, the entrance of the Libreville Hospital Center, the largest in the capital, was barricaded. So the patients obviously made a U-turn. The minimum service was, however, assured them.
Well, Jero, so since Monday, we're told that the strikers have hardened their tone and their stance by limiting the number of consultations per day and also per service to 10, just 10 that is. So this surely is not good for sick patients in Gabon.
Indeed, Jerry, some patients we met are annoyed by the situation, to say the least. But for the moment, we cannot really speak of a hardening of the movement limited to 10 patients a day. We were able to see the professionalism of the strikers who, in spite of everything, told us that the objective is not to harm, but simply to call on the government to respond to their grievances. Moreover, they are determined to hold this position until the specific transversal demands are fully satisfied. Now, there are conflicting opinions on the issue. Have negotiations been initiated with the government? According to the health care workers we met, no discussions have been held with the government up until this moment. In any case, A notice of extended strike action was filed on Tuesday in the Office of Health Minister Max Limoukou.
Donc, avant-hier, au cabinet du ministre de la Santé, Max Limoukou.
This coalition of health sector unions also denounced the indifference and silence of the government, which had initially filed a notice that expired on September 13th. So, no, for the time being, negotiations with the government have not started.
Donc, non, pour l'instant, selon eux, les négociations avec